Hi all, this is Akshay. A lot of discussion is going in the media about using plasma therapy to treat COVID-19. So in this video we are going to learn how plasma therapy works, how it's going to be used for COVID-19. So is it going to be a ray of hope in the fight against COVID-19? So watch the full video till the end to learn this. Is it the first time convalescent plasma therapy is being used to fight against a viral disease? The answer is a big no. So let's see in the history where and all it has been already used. In 1918 Spanish flu pandemic or the H1N1 pandemic, it was experimentally used for the first time. And again in 2009 when H1N1 reoccurred, so again the same plasma therapy was used. And in 2014, WHO recommended it as a fighting measure to treat Ebola. So this is not new to the medical world. So then what is convalescent plasma therapy? To know this, we will dive deeper. So what is convalescent? Convalescent means a person who is recovering from a disease or an infection. And as we all know, plasma or blood plasma is a liquid component of the blood which carries the cells and the proteins throughout the body. And also the same plasma contains the antibodies when the body reacts naturally with an immune response to some pathogens. Now, the convalescent plasma therapy is the extraction of the plasma from the blood of a person who is recovered from an infection or disease and ingesting the same plasma to the person who is suffering from the same disease or infection. This plasma, which is extracted from the person who has recovered from a particular disease, in this case COVID-19, contains a rich amount of antibodies which were generated as a part of natural immune response to the viral infection or disease. These particular antibodies are highly specific to a particular disease or infection. So the extraction of plasma is not easy as it sounds. So before it goes to that process, the blood of the donor or the person who has recovered from a disease will undergo a lot of clinical checks. So for diseases such as hepatitis A, hepatitis B, and HIV and multiple other infections. So once it is confirmed that the person is out of danger, then only the plasma will be extracted and then it will be further moved to the next process. Use of convalescent plasma therapy to treat COVID-19 is not yet considered to be ready to go or as a ready to go solution, since the number of clinical trials done on this process or on this method are in a very less number, and we cannot think that this is the right one to go. The use of convalescent plasma therapy against COVID-19 needs a lot of clinical trials to prove that it is really effective to fight COVID-19. Convalescent plasma therapy involves certain risks as per Johns Hopkins University immunologists. The chances of inadvertent infection being transferred to the patient, or the chances of the current infection becoming worsened, or the natural immune response of a patient could get affected. Early clinical trials done in China and US reveal that the convalescent plasma therapy used for patients with COVID-19 shown a measurable increase in immune response compared to the other patients who are not treated with convalescent plasma therapy. However, this is too early to come to a conclusion that this is the effective solution for the fight against COVID-19. But this has of course sparked a ray of hope for all of us who are looking for a final solution to fight the COVID-19. Thank you so much for watching this video. Like, comment and share this video with your friends and connections. And also like and follow our QXP page. And do subscribe to our YouTube channel. And press on the bell icon so that you can get the notifications when the next video is released. Thank you. Stay tuned.